Research makes a vital contribution to providing evidence for regulatory policy, to assessing the impact of regulation, and to promoting improvements in regulatory processes in order to better protect patients and the public.
As a social work regulator, we believe that it's really important to engage in research to understand the information and intelligence that we hold and to then better inform the profession that we regulate.
I think primarily for us to understand the pressures that our professions are facing, the challenges that lead to requirements for changes in regulation.
Research is really important to regulation because it gives empirical evidence that informs both policymakers but also employers. It can really highlight professions that might need a little bit more attention, and also in identifying what it is about those professions that need support.
Research in all forms, really, externally and internally, helps us to understand what we do to perform our function to keep patients safe, protect their well-being, uphold the reputation of the profession, and ensure that osteopaths are able to kind of work in accordance with their practice standards.
So the work that we've done has really highlighted using staff surveys in a different way to identify organisations that might have more issues.
Then I think also it helps us develop the tools and guidance to support our registrants across their working life.
So an example of that is a small piece of research that we did to understand why service users are motivated to complain about social workers. And what we found was that the relationship between the social worker and the service user was really important, and where that had broken down, the service user then felt that they needed to complain about the social worker.
For me, professional standards has really opened a door into providing a space to think about work and also the data to then facilitate empirically studying that work.
We're able to use research across a number of different ways to make sure that we're a fair and proportionate regulator.
When we develop policies, we need to understand through some kind of research really what needs to be done, how they compare across other healthcare regulators and professions, and to assess the impact of that so that we know what we do makes a difference.